Hi everyone, welcome back to my YouTube channel. Today we are Norma Occipitalis. First, we'll start our topic with introduction. Norma Occipitalis refers to the posterior view of skull, highlighting the occipital region and related structure. This perspective is essential for studying cranial anatomy, neuroanatomy, and forensic identification, as it provides insights into the bony landmarks and attachment site for muscles. Now let's talk about the bones that are visible in Norma Occipitalis. Several bones and suture contribute to the posterior structure of cranium. They include occipital bone, that is unpaired bone, parietal bone, that is paired bone, temporal bone, that is paired and partially visible in the Norma Occipitalis. First, we will talk about the occipital bone. It forms the posterior part of skull. Its features include foramen magnum, through which the spinal cord passes. It contains external acoustic protuberance, occipital protuberance, that serve as a muscle attachment point. Next bone we are going to talk about is parietal bone. It is pair bone, that means there are two parietal bones in every skull. They are located at the upper posterior part of skull. It articulates with the occipital bone at the lambdoid suture. Next bone we are going to talk about is temporal bone, that is pair bone, that means there are two temporal bones in every skull and they are partially visible in Norma Occipitalis. They contribute to the posterior lateral region and includes the mastoid process, that is important attachment site for muscle involved in head movements. Now let's talk about the key features of Norma Occipitalis. Key features include lambdoid sutures that connect the occipital and parietal bone. It also includes external occipital protuberance, that is bony prominence serving as an attachment site for ligaments and muscle. It also includes superior and inferior nuchal lines that are horizontal ridges on the occipital bone aiding in muscle attachment. And it also includes foramen magnum, that is large opening at the skull base that allow passage of the spinal cord. Now let's talk about the clinical and surgical application. The first clinical and surgical application is neurological assessment. That is understanding occipital bone structure aid in diagnosing trauma. And cranial surgery, as it provides access points for the procedure involving cerebellum and brainstem. And forensic identification, as Norma Occipitalis is used to assess skull shape and individual identity in forensic anthropology. So this was all about Norma Occipitalis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. And do appreciate our efforts that we made for you people. Thank you for watching.